Yeah. Right, do you know your height in centimetres at all?
I think I'm 170 and this is
We'll do it just to check. You will need to take your socks off as well. It's a bioimpedance scan, so...
Oh, of course, we need to be able to. Okay.
Place your heels on the rear sole.
It's going to rescan.
Okay.
So stand with your back against the height measurer for me.
Yeah.
Stay as tall as you can. Like that shirt. I
Scottsdale.
love an affiliate shirt.
Scottsdale.
You are 169,
There you go.
1 centimetre shorter. So stand on for me.
Okay.
The
On
first,
this thing.
yeah, heel goes onto the back bit. Perfect. Now, if you enter your mobile number for me first of all.
Good.
My laptop reading. Perfect. Press next. In the top right corner, it will say same as ID. Just push that button.
That's same as I am.
Yeah, push that one. Press next.
Oh, I see.
169 is your height, and then follow the rest. Press next.
Okay.
Input your age. Select your gender. Then press Start Test.
Okay. Start test.
Yeah, start test. Press agree, and then press next.
Place your heels
So the heels and feet are fine. If you grab the handles towards you first,
Okay.
same on the other side as well.
Yeah.
Thumb goes on the front of this part here. There you go. Same on the other side. And then your hands away from the hips as far as you can go. Just reach forward.
As far as I can go.
Yeah, basically just really actually push your hands forward.
Okay.
We're looking for space here between your armpit and your...
Oh, I see. Okay.
Good. It will start.
Place your heels on the rear sole electrodes.
That doesn't like something. Okay. Yeah.
Starting your InBody test. Do not talk or move during the test. The test is completed.
Okay. Well done.
That's it.
Yep. That
Okay.
is as invasive as it gets.
Okay. Can I put my
Socks
clothes back
on,
on?
shoes on, jumpers on,
Yes. Thank you.
whatever you want.
Okay.
Just want to make sure that we can see this for our
Gloves.
training video. Perfect. Just going to zoom into my screen. Have you done one of these before?
No. I think a similar one, but not the
Not
same.
an InBody scan.
Not an InBody, similar kind of thingy.
Perfect.
A very long time.
This one down that fraction. Thanks for letting me record it. Okay, it's just for our team training.
Oh, sure, no worries.
Okay. So it's quite an extensive report
Okay.
that we end up getting.
Just from that little assessment.
Yeah, absolutely. It's got like a 98% accuracy when compared to a DEXA scan. So
Oh, cool. I was going to book a DEXA scan, so
yeah.
that's pretty useful.
So
Okay.
a really good level of accuracy. Now, it's quite sensitive to primarily food consumption.
Okay.
So that's why we do ask that you try and avoid food for 2 hours prior to the test. But
That's
ultimately,
fine.
what we want is a repeat of whatever you do. So if you
Yeah. Okay.
did have food a couple of hours ago, you just
Yes.
kind of go into the same routine that you would always have.
Right.
So when I rebook your test, it's going to be same day, same time.
That's good because I
so then
pretty
it
much
gets
always
you to
eat
the routine.
breakfast at like 8 o'clock
Yeah,
or whatever.
perfect.
7. Okay, cool.
So that would just help with the accuracy of our
Yeah.
results.
Okay.
Now it works on a traffic light system. So on the right hand side, you can actually see there's no need for improvement. Okay, and
Nonsense. but
everything's green as we come down, but there are things that you might want to change. So
Yes.
we're looking at this from a health perspective, very much like if you walked into your GP. So they're going to say to you, actually, from what we can see from the data, there aren't any real needs for things for you to change on.
Might be
But
once.
that doesn't necessarily mean that there aren't ways to improve your health. So I'm going to highlight those as we go through.
Okay.
Okay. So first thing that we look at is your weight, your muscle mass, and your body fat mass. Now you're classified as a D type. That's a strong D type, which is good. If I zoom into your results, we'll kind of explain why. So you're of a normal weight, although we typically don't see that weight as an important metric.
No.
What we're looking at is more your muscle tissue and your body fat mass.
Mm-hmm.
The 100 markers, these are all percentiles, and it is a percentile based on your gender and your height.
My height, not my age.
Not your age. So regardless of how old you are, you still want a good level of muscle mass or body fat mass or whatever. It's all to do with just how tall you are, how much you weigh, and your gender, essentially. So you're above the 100 percentile mark for muscle tissue. So we would want this to essentially just gradually creep up over time. And then when we had our soft tissue work, we spoke about protein consumption, so that's going to be important for this figure here.
Right.
And really, because this is scan number 1, I don't know whether that number is on its way down, on its way up, at your maintenance level. We don't really know yet. So that 12-week mark, you'll be able to determine whether it's moving in the right direction or not.
Right.
Now, you are welcome to scan before that.
Okay.
I would encourage you to maybe do it at the 4-week mark, so in about 4 weeks. You could just come on, stand on the scanner, enter your mobile number, and I would look at this number.
Okay.
Whether it's coming up, going down, staying the same.
All right.
Does that make sense?
Okay, yeah, that makes sense.
And then you can tweak your nutrition based off of that.
Right.
So we spoke about getting a bit more fish, increasing your protein consumption overall day to day.
Okay.
This number would determine whether you need to do that. So if
okay.
it's coming down, we definitely need to increase that because we know it's not your training, and you eat pretty well, you sleep pretty well, so we would want to try and just adjust that protein number up.
Okay.
Okay?
Okay.
Your body fat mass, now it's kind of grayed it out, and the reason it does it is it asks you to make an informed decision as to whether that is too low, too high, not enough, etc. So what it's essentially asking you is, because it is in the low category, do you know if you've been through menopause yet?
I'm going to perimenopause.
Your perimenopause. Okay. So if you'd essentially lost kind of your hormonal cycle, and that consistent cycle, more if you were in your 20s, 30s, if you had lost it, it may be because your body fat mass is too low. So your body would essentially go, I don't think I can host children because and therefore you lose your cycle.
Right.
You would want to increase your body fat mass. And now this can affect your hormones, having your body fat mass this low. So actually you could increase it, but then look at how your body fat mass improves. Be in more of a calorie surplus, essentially.
It's so interesting what you're saying to me, because that's not going to tell me, but obviously my hormones are affecting this somehow, I would think.
Probably more the other way around.
Affecting my hormones.
Yeah, the amount of food that you're consuming can affect your hormones. And things like sleep quality, things like that, it can have an impact on. It's really hard to determine when it's scan 1.
Okay.
Because we don't know what the changes are. But what this indicates is that your body fat mass is lower than what we would deem the healthy level. The numbers here are set by World Health Organization.
Oh, wow.
So they are actually collated through a large cohort of studies of what we deem the healthy level to be for a female to maintain optimal hormone levels for a female. And that can be impacting on simply things like stress, that you struggle to switch off from work, or again struggle to fall asleep because your mind's going everywhere. Actually, your body fat mass can control your hormones and affect those kind of things. So it's hard for me to know because I haven't done blood tests. I haven't looked at whether you still have a cycle, and so that's why it's kind of grayed it out. It's asked you to make a decision as to whether you feel like your hormones are affected by your body fat level. And again, it's hard to tell.
It's such a random question for a 51-year-old woman, because effectively I'm at the stage where I'm about to.
That's why I said it's easier to determine that if you were 20 to 30 than it is at 51. How old are you? 51?
I'm 51. And so, I'm actually at what's regarded, I have a fairly regular cycle. It's not completely regular. The last few months I'd say it's become a little more irregular, but it's still almost, between 26 and 30 days, which is pretty
Yeah.
regular.
Yeah.
It's still going for the same regular amount of time. There's not huge fluctuations in it, but I'm feeling very perimenopausal, if you want to put it that way.
Yeah.
So it would be interesting, what you're saying there is a real shock to me, because the thing that I most want to get out of joining the box again is it's the distribution of the muscle. So
Of muscle mass.
Yes, muscle mass. Because what's happened for me is that my shape has changed, I'd say, for me drastically in the last 5 years. Even though I've still crossfitted, still lifted weights, still done things that I used to do.
Yeah.
And that's the part that I'm most struggling with.
Okay.
And so it's interesting though that it's almost telling me, well, you need to put on some freaking weight here, chick.
You need to put on some body fat. Yeah.
That is just,
Yeah.
I'm not sure what to do with that, but okay.
But again, that's why it grays it rather than turns it red.
No, I see what you're saying, but
Yeah.
again, and potentially, I'm too thin at the moment, and it's affecting my hormones.
Potentially.
I don't know.
Yeah.
And again, this is always, that's for me, I never look my weight.
Yeah.
Never, because I'm assuming if I'm putting on
Muscle mass.
muscle, which is
You're
what I
weighing
want,
off,
then
yeah.
I don't really give a shit what my weight is. Like, so it can fluctuate between 60 and 56, whatever, you know,
Yeah.
and I'm kind of like,
The thing for you to kind of look at and understand is what is your level of performance in the gym. You know,
Okay.
if you're eating a fair amount of protein, your muscle mass seems to be going up, you're training a minimum of 3 times a week, you are sleeping pretty well, but that you come into workouts and you just feel like, I just cannot go. I do not have a go button. You know, if coach says to me, sprint at 200 meters,
I'm like,
and you're like, I feel like a slug. I just cannot sprint it. It may be that you don't have the right level of body fat mass to push that go button, and that's because of your hormonal response, not necessarily to do with like carbohydrate stores and things like that. Essentially, your body may be like chronically stressed, and so it just goes, right, I'm just going to like slow down all your processes, keep life pretty simple, so that when you go through that like flight or fight response, you just don't have a response that's that quick.
So what is what's my HRV telling me?
It wouldn't tell me off.
But I've got my HRV on my Oura ring.
Yeah.
And it's not great.
But you know what your baseline is.
I know what my baseline is, and it's rubbish, my HRV.
Yeah, but then it's really genetic. So
that's interesting.
the Oura ring will like learn from your first 14 days, I think it is.
Well,
Maybe it's longer.
I've had it since
Can't remember.
2018.
Yeah.
So
and have you always sat at basically the same
I
line?
actually had ChatGPT analyze it recently.
Yeah.
And I don't know, that's interesting. I'm just trying to understand everything what you're saying. This has just kind of shocked me, to be frank. But I do find, and I don't know if that's why it'll be good to do this in like a month, because I'm working out, I come here, do an amazing workout, love it, and then I feel a bit shattered for a day or two.
Yeah.
And
So that would potentially mean that you're under fueling. So you're not fueling your recovery.
Okay.
And
So it's back to the nutrition piece that
yeah.
and it's definitely become more of an issue for me since I'm perimenopausal.
Yeah.
Yeah.
Your protein intake actually goes up when you're in menopause.
Yeah.
So annoyingly, you
more.
require even more protein.
Which, but I mean, like
if you
this
weren't.
week
So,
as an example, since we spoke, I mean, I've eaten so much fish.
Yeah.
Yeah.
And do you feel any different off of the back of it? Not really.
I don't know. I mean, it's also very difficult because I'm also hugely aware of within my own hormone cycle. You know, I'd say a week prior to my period, I feel very sluggish.
Oh yeah. Okay.
Like just generally, like very low motivation. My energy levels dip, and and then I know I'll have 3 days of period kind of thing, and then I'll be like,
yeah, you feel like a superstar.
Toast, and I'll come in the gym and I'll just PB everything, and I'll be like a superwoman.
Yeah. So the fact that you have those hormonal fluctuations may indicate that your body fat mass is not affecting things like your cycle and your hormones, because it's normal for you to have those fluctuations.
Right.
The downside would be if you have your period, then you get into the new cycle, but you still feel sluggish.
Right, and I
that
don't
would
have
be like
that.
why don't I have that up? Why do I feel like I don't? I don't
Okay.
have that peak.
Okay.
That would indicate that you're not having that driving progesterone.
Right.
And so the fact that you feel like Right, it's 1 rep max day. Let's
Yeah,
go. I'm
let's
into
go, I'm
it.
in, yeah.
That's a good sign because it
Okay.
means that you probably do have that function.
Okay.
That makes sense.
Yeah, but I think we also just need to give some time to the
Yeah.
whole diet thing, and let's
Absolutely.
just give, we're not being patient, which I am,
And that's why I said measure in 4 weeks' time.
Yes.
Rather than wait until
Yeah,
I'll
yeah, yeah.
repeat in 12 weeks.
Okay.
Because you'll be able to just look at this muscle mass number
Yes.
and this body fat mass number
and see what's
and
happening.
see whether they're going up, down, staying the same,
Okay.
and just make a few adjustments there.
Okay.
That is quite simply a measure of if this goes down and
Yes.
this goes down, you're not eating enough. You need more food.
Okay.
If both go up, you then determine whether you're happy with that body fat mass going up or not.
Right.
I would look at how am I performing?
Yes.
Am I starting to lift more weight? Am I starting to feel injury free
Okay.
and pain free?
Yes.
You'd look at like what happens in the gym.
Okay.
Ideal scenario may be that your body fat mass stays the same, but muscle mass
Mass
comes
goes
up.
up. Okay.
Yeah. The big worry for me would be if that muscle tissue's on its way down.
Okay.
That's where you'd really need a bit of an intervention.
Okay.
Okay?
Okay.
While we were on the topic of where you carry your muscle mass, I thought I would highlight this. What do you mean in terms of your body shape has changed? In what kind of way?
So, first time in my life I have belly fat.
Mm-hmm.
Well, I don't know if it's belly fat or what's going on. I have like a swelling in my belly.
Yeah.
And I've literally, honestly, if you saw me pregnant, they were like little bumps and they were like out and they was gone. And I just never had this kind of, like a belly, I would call it. I mean, it's not bad, but for me, it makes me feel uncomfortable.
Okay.
And my legs, whereas I felt like I used to have quite a lot more muscle here, it's much looser. The skin is the muscle doesn't feel as tight. And you put it to that, it doesn't feel as toned.
Yeah.
And I don't really know why.
So then it can be back to you not repairing that muscle tissue because you have been training. You were training somewhere before, but again, if you're not eating enough protein, you're then not going to be growing that muscle mass.
Okay, that makes sense.
Potentially, your muscle has been atrophying and reducing in mass, leading to you feeling weaker.
I feel the atrophy.
Smaller,
it's interesting. Like I am aware of the atrophy.
Yeah.
I can feel it in my.
Yeah.
Specifically, I would say in my legs. I don't mean not in my arms and stuff, or none of that kind of thing.
Well, what we tend to look at, again, these are percentiles against what World Health Organization would deem a healthy level for a female of your age. We want above 100%, and you are on all aspects. You can see that your upper body has maintained muscle tissue better than your lower. So whether that is that you've had a desk job and you sat and have typed and done things, or that you just have used your arms more throughout the day than your legs.
Yes.
What we would typically look at is this is just general use over time. So cooking, cleaning, all those kind of things would typically be upper body movements.
Yes.
This is step count at the bottom.
Okay.
So this doesn't mean that you did squats in the gym and this is shoulder press in the gym. This is day-to-day habits. What do you use more? And this indicates that you use your arms more than your legs day-to-day. What we would want to see is this trunk number gradually come up over time, and that's because CrossFit is core to extremity movements.
Yes.
Weights moving from the ground to above the head, or everything around the hip generating momentum, even if it's a run, a kettlebell swing, a clean, whatever.
Okay.
So we would want to see this number come up, and that indicates that you're actually getting things right technically in the gym. And so we would see that come up as long as, again, you're eating enough protein to fuel the growth.
Right.
Yeah.
Okay.
So the reason that we tend to have your first 12 weeks, you're slightly more advanced because you've done CrossFit before. But for most people, the first 12 weeks is all about just get into your training.
Right.
So once they've done the 12 weeks of, yes, I've managed 3 a week, I've done really well, I can then go, well, now we need to change the food.
Okay.
So as long as you can tick that exercise box,
yes,
we can then help you with the nutrition. If you're like, well, my training's inconsistent, then it's really hard for me to then go, let's fix your food. Because if your training's inconsistent, so is your calorie expenditure. And so that's why we want to be in a consistent routine with your training. Okay? Does that make sense?
Yeah.
Now we've got some other things. Your water ratio is a little bit above the normal. which may lead to things like that feeling of puffiness.
Okay.
So what we look at is your intracellular number. This will be directly correlated to the amount of cells that you have, and therefore your muscle mass.
Okay.
So this top number will always move in line with your muscle mass. If your
Okay.
muscle comes up, so will that, because you've got more cells. Okay. Your extracellular number is the amount of water that's needed to feed those cells.
Okay.
Now, when you have a high ECW ratio, your extracellular water ratio,
Yeah.
it can indicate inflammation.
Yes.
So whether that's because of injury reasons, hormone balance reasons, lack of recovery, lack of sleep, there are many factors that can impact that.
Okay.
Or whether you've had quite a lot of water 2 hours prior to the test. Do you know how much?
No,
fluid you've
I have
and
not
stuff
had
this
a
morning?
lot. I don't think I've had a lot of
No.
water this morning, but
Okay.
I am feeling inflamed in both. I mean, my quads are still on fire from Friday's workout,
Yeah.
and my shoulders feeling tender.
Tender.
So there's inflammation. I can feel it.
Yeah. Okay.
So possibly.
So that would come back to the discussion that we had after soft tissue about getting your like fish oils in and your anti-inflammatory style fats in.
Okay.
Again, kind of coming back to this picture as to whether you're consuming enough fats like salmons, healthy nuts, seeds,
Yeah.
those kind of things to impact your body fat mass and your recovery.
Okay.
Yeah.
Yeah. I mean, I think I consume a lot of fat, healthy fats. I mean, I eat nuts all day long, and salmon. I've only just.
Yeah.
I've increased the fish based on our conversation, basically.
Good.
You know, so I think interestingly, because I went and did a little my own reading on protein sources and stuff, and understanding, you know, the gram value of plant-based protein versus meat-based protein, and for sure, you know, there's just kind of no comparison to how much better it is to be.
Yeah.
Well, I think if you're me.
Yeah.
I think if you're me, because, you know, like I told you, I was Dr. Stacey Servants, who I, you know, I'm a huge fan of, and she is a vegan. I mean, and if you see her, she is ridiculous what she looks like, you know, and she's older than me. But I think she's also the kind of body type that easily gains.
Yeah, your genetics will play a huge part.
You know, whereas I know that I'm more of a, whatever, like an ectomorph kind of body type kind of thing. So, you know, I think, I've tried being vegetarian fully in my 20s and was training really hard and purposely put myself on, took myself back to fish.
Yeah.
Because I was just like...
Because of that.
Well, because I just knew I wasn't getting enough and no amount of shakes and crap was going to do it.
Yeah.
So, you know, went from no meat to back to fish, and I've always eaten fish ever since. So I think I need to do what you're saying, just eat more meat.
Yeah, perfect. And again, when we rescan, you'll give yourself the data to determine whether your muscle mass is on its way up.
Yes.
And if it is, the likelihood is that you're then having enough healthy fats in order to reduce your inflammation, reduce your swelling.
Yes.
So that is where we would look at that water number and see if we can bring that ratio down. That would give us a good indication that you have an anti-inflammatory response because your recovery is improving.
Right.
Yeah.
And
you've got the physiological response of like your soreness.
Right.
Does your soreness only come for a day rather than 2 days?
2 days.
Or does it just stop coming completely?
Yes.
If you notice those kind of changes, the likelihood is that you're recovering much better.
Okay.
So yeah, you can start to feel that change as opposed to see it on a result sheet.
Oh, that's interesting. So you're saying that okay, that's very interesting. So you're basically saying that the recovery should become better, not just because I'm being consistent, but actually through the diet as well.
Yeah, nutrition is how you would change.
Okay.
That is what will encourage you to repair your cells. The way that we tend to explain it is this thing next door is how you break down the body.
Yeah.
It's not how you fix the body. That's what happens during your food and your sleep. So.
Okay. And I'm not worried about my sleep.
It might be that you're really good at breaking it down.
Fabulous. I'm so good at that.
But that we need to be better at then repairing the cells afterwards.
And accepted that my demands are higher.
Absolutely.
Partly because of the perimenopause, menopause.
Yeah. Be a different story if you were brand new to training. Because if you're brand new, you're not used to the exercise.
Well,
so they will get
that's
sore
kind of
sooner.
a puzzle, is that I'm feeling like I'm brand new to training, and I'm like, that does not make sense. Because it's not like I haven't been training and then I'm here.
Yeah. The really interesting thing for you, because you have more data, and depending on the accuracy of it, is things like your Aura ring.
Yes.
Going, right, if I up my calorie intake and eat more food,
Yes.
how does my HRV respond to that? Because if
Ah.
your recovery is improving, your
Yes.
heart rate variability will improve with it,
Yes.
alongside it.
Okay.
So it'd be interesting to see what happens to your HRV as long as your water ratio is improving, your muscle mass is coming up,
okay.
those kind of things as well.
Okay.
Be just an interesting
It
correlation
will be
between them.
interesting to see. Yes. Okay.
Okay. Now we also have something called phase angle. This is to do with the health of your cells. So this gives us an indicated risk of illnesses, bacterial, viral infections, things like that. We want you inside the grey line or higher. Brighten the screen up a little bit. So you're inside the grey line, which is good. Anything above 5 is a healthy level. This again looks at things like cell repair. So if you're breaking down your tissue and you're actually getting a good amount of recovery, you'll sit above a score of 5, which is where we want you.
Okay.
Again, if we increase protein and your recovery improves, we should see this number come up.
Okay.
Yeah. For someone that's training consistently, we would expect something above the grey line.
Okay.
So that's the kind of target.
Okay.
Is that as you increase the amount of potentially food, protein, healthy fats, whether that number comes up with it as well.
Okay.
Yeah. It kind of lowers your risk of illnesses because you're getting good cell repair and recovery.
Okay.
All right. Now, last thing is going to be your InBody score. Now, this again is from a recommendation from World Health Organization, but isn't necessarily the right way for you to go. It is a computer algorithm.
Oh, I see.
So it recommends a slight increase in weight by bringing your body fat mass up. So that would want you to try and get closer to the 100 marker. And that's
Okay.
essentially where it wants you to sit.
Okay.
It recommends no necessary change to your muscle tissue though.
Okay.
However, we
Yes.
want you to be much stronger
Stronger.
and have almost like a bigger head start to frailty,
Yeah.
and strive that off for as long as
I'm
possible.
Keen on the stronger part.
Yeah. So that's kind of the target, and that would
Okay.
sit you at a target weight of 60 kilos,
Oh,
about
wow.
60.
Okay.
Any questions? I know it's quite extensive, so lots to talk through. But there is an InBody app you can download
Yes.
where you enter your mobile number and it has all of your results on there.
Okay.
It's a really user-friendly style kind of approach, so you can click on every single bit and look at your data,
Cool.
and you might be able to then even screenshot both your Aura ring and your
Yes.
InBody and stick it in ChatGPT and look for correlations between
Okay.
repeat tests
Okay.
to see if there is an improvement in things like HRV, resting
Right.
heart rate. As your InBody score comes up and improves, you
Right.
should see a correlation between the two.
Okay.
Depends if you're a data person or not.
Wow.
So
Sometimes. But
Sometimes.
I don't want to obsess. I don't
Yeah.
want to obsess.
Yeah.
I really, for me, I just kind of want to, I want to feel good. I want to feel strong. I don't want to be in so much pain. I want to feel like I take 2 days to recover. I don't want to feel like I've got this injury.
Yeah.
That's kind of, for me, the goal right now.
So continue with the rehab stuff. That's where I would get a little bit more food in and see if that helps with your recovery
Yeah.
and helps with your soreness.
Yeah.
And then retest yourself in 4 weeks' time. You would
Okay.
simply come on, enter your mobile number, rescan,
Okay.
and then see what happens to these results
Okay.
to see that muscle mass is on its way up
Right.
rather than on its way down.
Yes. Okay.
If it's on its way down, we have to
Okay.
intervene
Okay.
and increase that protein intake.
Okay.
Yeah?
Okay. Yeah.
Any questions at all?
No, I think it's good. It's very useful.
Great.
Yeah.
Yeah, we kind of see this is your measurement of health. That's your measurement of fitness in there.
Right.
Starting to track your workouts and things like that.
Okay.
That's kind of what we can control.
Yes.
And then my job in here is to guide you on your nutrition, your sleep.
Right.
But when we have a bit more data,
Right.
this
okay, then
is the equivalent of you just putting your Aura ring on for the first time. It doesn't tell you much.
No.
So in 12 weeks' time, we'll be able to have a much better view of where you're moving to
Okay.
and intervene if it's needed.
Right.
Yeah.
Okay.
Awesome. Anything else? No?
No, I mean,
Okay.
the only thing I'd like to ask about is just this nutrition course that
Yeah.
you guys are running.
Sure.
I mean, what would be the benefit of me coming to do that?
Group accountability. So we now have resources like ChatGPT. You could
Yeah.
take your InBody scan, stick it in ChatGPT and ask it to write a diary for you. a food diary based around your nutritional preferences.
Okay.
The thing that it can't do is then remind you every single day of keeping going and making tweaks and making changes. The nutrition group is all about having that cohort of, it is all women at the moment, but cohort of women that essentially go, you're able to post a picture of a breakfast and you'll then have support from myself and Meg to go, that looks right, I would tweak this, how about adding this in, whatever it might be. So it gives you that like group cohort of people that are all trying to improve their nutrition in some way, shape or form.
Right, and we can just
and yes, you could get a robot to do that for you,
but it's quite fun to do it with people.
Exactly.
Okay.
It's not the first course we've ever done. Meg and I have done courses together at our previous job. We used to work in the same CrossFit box prior to here. And so we've basically taken that model and applied it. But the difference for it here is that we have different pathways for people. So we will have the same kind of weekly habit if it's water, for example.
Right.
But dependent on which pathway you pick, your target will then be different. So if you're an avid CrossFitter and you want to do 6 sessions a week, your water target's going to be different to someone that's like, well, I work, I have a normal life, I'm only getting 3 sessions in a week, therefore that's your target.
Right.
So you have kind of a bespoke pathway dependent on how you define yourself as a member.
Okay.
Yeah.
Okay.
So yes, £99. We've got 4 spaces left.
Yeah. Okay. I think I'll sign up for that.
Awesome.
Fun. Yeah.
Cool.
Yeah.
Yeah, it's group accountability. Nice way to get to know other people in the community as well. And we have a private WhatsApp group that if you sign up, I can add you to.
And then just lastly, just remind me again. I'm just gonna check that I'm doing this. Am I supposed to be doing my things this way or that?
Thumb out so that your shoulders externally rotating.
When I'm doing it.
Yeah, you can see that it sets your shoulder straight away when you turn it.
Totally when I do that, and then when I'm doing this one, same thing.
Same.
Okay, alright.
Thumb out.
Check that one.
Yeah.
I couldn't remember if it was that way. I was like, okay.
You still get fatigue in the middle of your like shoulder blades when you do it?
Well, I mean, I haven't done that much, I won't be honest.
Okay.
So I lied to you.
You've got to do it all the time. You have to be meticulous with it.
Yeah.
You might think about all the time that you've sat on a computer or cooking, cleaning, whatever with those shoulders forward. You're now trying to undo all of that work. So you've got to do it every day.
Okay.
Just got to be meticulous with it.
Right. Cool.
Okay.
Thanks, Barry.
The thing that I tend to recommend for people is try and habit stack them.
What does that mean?
So you already have a habit that you might do every single day, like brush your teeth.
Yes.
Try and stack your band pull aparts and exercises around something you already do every single day.
That's a good idea.
So if you already think, right, I do that. Brush the teeth is what I tend to recommend for people.
That's a good one.
So you brush your teeth for 2 minutes, you do 2 minutes of your band pull aparts. You habit stack things together.
Like that.
Yeah.
Okay.
Or you always come down and you make your morning coffee. While your coffee's brewing, you do your pull aparts. So you stack that habit with something else. And the association of the habit you already have means that it will remind you to do it.
Yes, it doesn't feel like, okay, this is another thing I've got to add to my day.
Exactly. It's just added into whenever you already have a habit.
Okay.
It's a really good way to do it.
Okay, I'll do that.
It's a book called Atomic Habits.
Of course I haven't read the book, but I've listened to 101 talks by him.